Okay, so we are recording now. So welcome to week 7. We're going to cover the 2 chapters from week 6 last week, chapters 11, 12, and then we'll cover the chapters for this week. Okay, so we'll be covering 6 chapters in total. Does anybody have any questions going forward before I go and give my housekeeping things? Tomorrow, your group project is due. Everybody knows that, right? And everybody has to submit. Okay, so I'm just looking at my top row here. Let's say LaShawn, Sierra, and Catherine are all in the same group. Okay, they need to all submit their final project under their name. That's how it gets populated in the grade book. Okay, so everybody has to have a submission. Okay, so yeah. So the initial ones are due tomorrow night, right? Tomorrow's Wednesday, right? Yep, tomorrow. And then your peer, look at somebody else's, a couple of other, I've already looked at a couple of them. They're good. Yeah, they're really good. You guys did a great job. Hi, Tony. Let's see, Tony's here now. Andres is coming in. Whoops, no. Andres is coming in here. So anyway, yeah, the few that I've looked at look really good. So you guys have done so far a great job with your group projects. Have you enjoyed the group projects? What do you guys think? I mean, hi, Andres. What do you guys think? What's your feedback about your group projects? Have you enjoyed the group work? Anybody?
I don't like projects, but I did like meeting new people from other campuses.
Okay. Anybody else have any feedback about your group projects or just working in groups in general? Okay. All right, well, I'm looking forward to reading all of them. This is week 7, but it finishes up week 6, which is, we're done with midterms, okay? Midterms are here. So I need to, for everybody that is sitting below a 78 right now, I need to fill out or complete a mid-module assessment. Okay, that's like the weekly at-risk reports. For this week, it substitutes the at-risk report. And this is a midterm assessment that goes to you. I'll send a copy to you, as well as your dean. Okay, and it's it identifies what your current grade is so far. You should all know your current grade, so you should know if you're below a 78 and be expecting one of these mid-module assessments. There's also an area to put any late work, any missing work, and some strategies that I would like to see you be successful, some strategies to use to be successful for the rest of the term. Okay, so I'm hoping to complete those today and tomorrow. I still have to do my grading for last week. I still trying to, in the process of grading your discussion questions from last week. So yeah, so that's what I'm working on. But you'll get a mid-module assessment if you're below a 78. I've offered for anybody that wants to meet with me with regards to reviewing exam 2. I really encourage, if you got below a 78, to meet with me to review the exam. But even if you got above a 78 and want to review the exam, I would highly encourage that as well. So I met with some people over the weekend, but not a whole lot. So please let me know if you want to meet, and we'll get some times together and meet. And there's still several people I still want to go over exam 1 with that didn't do well on exam 1. So you guys know who you are. But I'm offering this help, this support to you. So that's all I can do is offer it. It's up to you to take the support and take the tutoring and take the instruction. Based on some of the reviews that I've already done with students, if you struggle with math, I would highly encourage you to go back to the announcement in which I sent you Dean Brown's tutorial session. It's a long one. It's 4 hours. She did it one Saturday morning a couple of terms ago. You don't have to watch the whole thing, but it's an excellent resource if you're struggling with math conversion, setting up IV infusion rates, drop rates. Okay, so please go back and review that. I've sent you lots and lots and lots of resources first couple of weeks. So please go back. If you're having trouble with your exams and reading questions and breaking down questions, I've sent you a whole bunch of tutorials from Elsevier for students and test taking. The one I refer people back to all the time is the critical thinking tutorial. That helps you break down questions, how to eliminate answers right off the top. So, you know, I don't send them to you just to give you more work. I feel like these are helpful, and based on feedback from students over the last year and a half, these have been very, very helpful. So you've got to take advantage of the resources I'm sending you. Okay. Next week is Memorial Day. You guys are not affected. We'll have class as scheduled next Tuesday, but we might have a big class because I have 2 classes on Monday, and I have invited them to participate on Tuesday, my Tuesday morning class. So we might have a big group, which is fine. And next week is the 3rd and final week of exam 3 material. So today we'll cover weeks 6 and 7. Okay, exam 3 is week 6, 7, 8. Okay, so we'll be covering 6 and 7 today, and we'll be covering week 8, or excuse me, week 8 next week. Yes. And next week is kind of a big week. We cover 8 chapters. So between this week and next week, there's a total of 14 chapters. I've sent you guys all the PowerPoints. I sent it last week for week 6. I sent it this past weekend for week 7. So hopefully, if I know everybody's busy with all your other classes, but hopefully you've had a minute to, you know, review those PowerPoints and take a look at some of those case studies and at least have an introduction to what we're covering today. Okay. Exam 3 is 2 weeks from today, just to put everything in perspective, 2 weeks from today. Okay. So we're already in week 7. Okay. So with all that being said, does anybody have any questions before we get started? Because I do want to get going. Anybody have any questions about any of that? Okay. Why is everybody so quiet this morning? Is it because it's early?
Yes.
Okay. So we're going to pick up the pace in the next couple hours. Is that right?
Yes.
Who's laughing? Luciana's laughing. Okay. All right, let's get going. So I'm going to share my screen. Again, you have all the PowerPoints, which is your kind of your outline, your summary as to what we're going to cover. Just do a quick survey here. Has anybody had the opportunity to review the PowerPoints from week 6 or week 7? So if you haven't, that means you have no idea what we're covering. Does anybody know what we're covering today? Anybody know what the 6 chapters we're covering today are? Okay. That's kind of a bummer, but I'll do my best to help you understand all these chapters and all these topics. You should be getting exam 3 study guide, hopefully in the next couple of days. As you know, I like to give you those at the beginning of the weeks for cover of the exams, of the weeks that are being covered on the exam. So you should be getting those in the next couple of days. Hopefully we're working on updating that as we speak. And then you can go through today's material and start to plow through the study guide. We've already been through 2 exams, so you know how I tie in the lecture and all the information I send you on the weekends with the study guide, right? Everybody knows how we tie all that together, right? It's not new information. Everything is connected, right? The PowerPoint's connected to the chapter's connected to the study guide. They all connect with each other, right? Okay, let me share my screen and we'll get going with chapter, let's see, we're going to start with chapter 11. We'll do 11 and 12 first. So, and 11 and 12 are about, well, 11's about health education. How do we do health education in the community? Chapter 12 is about how we do a community assessment. Okay, Monica and Priscilla, can you guys turn your cameras on, please? Thank you. Thanks. All right, I'm going to share my screen. Okay. Okay. So let's go up to chapter 11. Okay, one of the things we know is that education as a community nurse, public health nurse is primary. That's what we're doing. Okay, that's the majority of what we're doing is health education. Okay, whether it's for an individual, whether it's for a family, whether it's for a community, whether it's for an aggregate of the population in the community, diabetics, young kids, older people, we're always using health education. Okay, so there's lots of factors that go into it. Think about has everybody been to a seminar or a training? Everybody has been to that for what? Orientation, for a new job, CEUs, continuing education. Has everybody been to a health education training? Okay. So that's what we're talking about here. So there's two parts to that. There's the educator who's teaching, and there's the learner who's learning. Okay, so we have to consider both. Okay, and how we're going to be successful with using health education. Okay, if you, well, since you haven't looked at the PowerPoints, which is your chapter outline, here's the things that are in this chapter, right? What is the nature of learning? What is the educational process? Okay, we need to think ADPI here as well. Okay, so instead of looking at ADPI in the hospital setting, once again, we're moving ADPI into the community educational setting. Okay, so we'll talk about all these topics. Okay, and again, please take a look at your objectives. After reviewing this chapter, you should be able to articulate these objectives. That's where my focused teaching comes from, of what we're pulling out of each chapter, the important concepts and the important topics. Okay, so Healthy People 2020 comes up early in this chapter. We're in chapter 11, we're on page 183. Okay, so we need to understand what some examples are that Healthy People 2020 identifies, examples of health education. Okay, so I would like for you to be familiar with these. And since nobody really reviewed the PowerPoints, I need you guys to do your homework as well. So I'm going to be going through and pointing out the things that are important to know in each chapter. Okay, so here's 4 examples from Healthy People 2020 with regards to health education. Okay, we know that when we're designing, implementing, and evaluating health education activities, it's important to learn about primary health problems in the community, right? We need to know what does the community need help with? What do they need education with? Is it a community that has a low immunization rate? Is it a community that has violence, an increase in violence? Is it a community that has in poverty? Okay, what does the community look like? Okay, and so we have to identify what are the primary health problems in the community. All right, so the goal of our educational program is to teach people what they want to know. Okay, we need them to participate. Okay, we need, right here in public health, it's important for the learners to participate in identifying the learning needs. Okay, and then that's going to get you the buy-in for people will be more engaged to help in the education process if they're engaged in developing and identifying and assessing what the problems are. Okay, so generally the education groups or whatever you're teaching is typically used to promote health promotion, and illness prevention. Okay. So for the example they give in the book is a community in which childhood and adolescent asthma is a big problem, right? So maybe then we develop a community-based asthma education and training program in the schools. We do a lot of this as a school nurse with childhood obesity. Okay, we know that childhood obesity is a major health concern. And so we as school nurses develop, pardon me, education programs in the schools to work with kids and parents about healthy eating, exercising. Okay. Sorry, I'm just still letting people in. Okay. Does anybody know the difference? There is a difference. What's the difference between education and learning? Anybody know that? What we're doing now is education. Okay. I'm giving you knowledge about a specific topic. Okay. The learning is what we do with that knowledge. Okay. So education is designed to help people change their knowledge, attitudes, and skills about a specific topic. And then in contrast, learning emphasizes that the recipient of that knowledge will make behavioral changes, will make changes, right? Remember that learning involves change. Change is difficult for many people. Okay, so that's the difference between education and learning. And what is the nature of learning? Right? One way to think about it is there's 3 domains. We all learn differently. Some of us learn cognitively, which is thinking. It's right here on page 184. Cognitively, which is thinking, affective, which is feeling, psychomotor, which is acting. Okay, we need to understand these 3 domains in order to provide effective education. It's trying to identify how people learn. I'm a psychomotor learner. I like hands-on stuff. What about you guys? Are you a cognitive, affective, or psychomotor? What domain do you fall in? And why?
I'm more of a hands-on psychomotor.
Yeah.
I learn better by doing it.
Mhm.
I would say the same for me.
Yep. Other people like to do things, on their own, right? They like to review PowerPoints, do the readings. Some people don't like to participate in group activities. We'll get into that in a minute, but here's a little bit more specific information about each of the domains. So cognitive, where we said is thinking. To expand on it a little bit further, this would include memory, recognition, understanding, reasoning. Okay. Affective includes changes in attitudes and the development of values. Okay. So how many of you know people that have deeply rooted attitudes and beliefs that it's very hard to change their thinking process? Okay. A lot of people. Okay. So that's what the affective domain is intended. It intends to change attitudes and the development of values. Okay. And where psychomotor is the hands-on. All right. So we may be teaching clients how to bathe their babies, how to change dressings, how to give injections, how to measure blood glucose levels, right? The hands-on learning. So those are your 3 domains of learning. Okay. So how does the educational process work? Okay. First of all, we need to do a needs assessment. How do we know what we're going to teach if we haven't done a needs assessment and identified the problem? Think about your ADPI here. This is going through ADPI in the community with community education. So first we're going to identify a needs assessment or identify the needs through a needs assessment. Box 11.1 is a good summary of what the steps are for a needs assessment. Right? Lots of factors can influence a person's learning needs. Okay? Demographics, economic, psychosocial, spiritual characteristics? What about the learner's knowledge, skills, motivation? Right? Do they have the motivation to learn? Do they want to learn? Do they want to be there? Are they health literate or are they health illiterate? Do they have hearing issues, visual issues that you might need to consider? So lots of things to consider in your needs assessment. Okay. Then after you've done your needs assessment, you establish goals and objectives. Again, we're following the ADPI, right? Third is selecting an appropriate educational method. Right? We want to choose methods that will facilitate your successful accomplishment of a program, right? Meeting your goals and objectives. Right? We want to be simple. We want to be, I mean, if you ever sat in a training session that you have no clue what's being taught to you, I have. You know, I'm really into when I go to training and conferences and meetings or whatever, I like to have a PowerPoint in front of me. I like to where I can take notes. I like it to be simple. I like it to follow what they said they were going to do. Okay, wherever the goals and objectives were set out for the program, I like for that to be followed. I don't like when we go off on different tangents and talk about everything else. I like to take notes specifically to what you say you're going to cover. All right. How do we hold the attention of the learners? You know, what if we're dealing with a group that may be hard to motivate? What if we're teaching kids? What if we're teaching preschoolers? So lots of things to consider with educational methods. Okay. Box 11.2 is excellent. It's the teach mnemonic, how to teach clients effectively. Have a look at that. Tune in, edit, act, clarify, and honor. Have a look at that. We also need to consider age, gender, culture, developmental disabilities. We just kind of went through this, special learning needs, visually impaired, hearing impaired, the education levels of people, motivations. What's the size of the group? Excuse me. Okay. Here's our levels of prevention here. Okay. Do you remember at the very beginning of this term, I asked you not to get tied up with education just in the primary level? Okay, here it is in all three levels. This is specific to this is the sample of how education plays into each of these levels. Okay, so in the primary level here, education at health fair, this is their example, education at health fairs regarding immunization for kids, adults, people with chronic illnesses. Okay, we're trying to, it's preventative. We're trying to educate to prevent. Secondary, we're using education here at health fairs for an early diagnosis and treatment of, say, diabetes. Right, we're doing screenings with the goal of shortening the disease duration and severity. That's that early identification, early intervention. Okay, and then tertiary education comes into play. We're talking about a group of people that have had a stroke. So there's education to be provided at rehab centers or adult daycares, working with people with strokes to maximize their functioning. Okay, so there's a good example of how education is incorporated into each level. Okay. Okay, this is an excellent box too, page 189, how to use plain language in health education. Okay, how do you organize your audience? How do you choose your words carefully? And how do you make information easy to find? Those are the three headers here. Okay, and some examples of how you organize, how you choose your words carefully. How do you make information easy to find? These health education programs shouldn't be complicated. You have to teach to your audience. Okay. Okay, so what are some population considerations based on age and cultural and ethnic backgrounds with regards to teaching? right? What this section includes, what kind of groups are we teaching? So we could be teaching Generation X, we could be teaching baby boomers, we could be teaching the digital age, right? We need to be aware of what types of, how do we teach these groups? I have a good, hang on, let me find that. I have a good summary. One sec. I have a good summary of those groups. So, okay, so Generation X. Okay. These are based on generational characteristics. Generation X learners are self-directed, write this down, are self-directed and like to work in teams. And then the next generation we call the NET generation. Right? They like everything digital, web-based games, virtual reality simulation. And us old baby boomers, that's me. We like instructor-led education. Okay, so that's a few examples of generational population considerations based on age, culture, ethnic backgrounds.
Can you repeat that real quick, please?
Yeah, of course. So we're talking about three different kinds of groups. All right, we're talking about Generation X learners. Okay. Self-directed and like to work in teams. That's most of you guys. Okay, and then we have our NET group, our I don't know, I call them like the Best Buy Geek Squad, right? All these NET guys, right? All these people we can turn to for any help we need. They know everything digitally, technologically, right? They know everything. One of my boys is like that. I can go to him for anything. I wouldn't have a clue. But, you know, because he's in his 20s, he's grown up in that generation. Okay. And then the baby boomers, which is me, the old ones. We just like instructor-led education. Here, just plain and simple. Okay, we're old school. So that's just a couple of examples of different ways different groups learn. Make sense? Does that help? Does that answer your question? Okay, and then there's a section on barriers. And you guys can read through this. There's educator-related barriers, right? Is your teacher, does she have a fear of public speaking, or he? Do they know the topic? Can they answer questions accurately when learners ask them questions? So it goes through a whole list of some of the educator barriers, and then learning-related barriers. Two of the most common learning-related barriers are low literacy and lack of motivation. Okay, so how do we teach to these groups? Nurses often deal with individuals and populations who are illiterate or have low literacy levels. How do we identify those groups? How do we work with those groups? Okay. There's a couple of health promotion models that I want to mention to you. One is the health belief model. It's HBM. I use the M for motivation. That's how I remember these two. Okay. The health belief model is used if you think motivation is going to be a concern. Okay. And it goes, and all I need you to know is that these are the couple of belief models that we're using. And just knowing that the health belief model has 6 components that you attempt to use and try and figure out what motivates an individual to learn. So it's all about a motivational model. Then the second one is it's TTM and precaution adoption process model. These two are used interchangeably. Excuse me. Okay, and this is model is used for health promotion. And they also have 6 stages. Okay. And then the last part of this chapter I want to cover is groups. We talked about groups at the beginning. You guys have just finished working in groups. So here's box 11.5. Please be familiar with this. Okay. There's many different roles that you may participate in as part of your group work. Okay. And you can all probably identify what your role would be in a group. Okay. For me, I like to be the leader. I like to run everything. I like to run the show. Tell people what to do, when, how, whatever. There's other people who really don't want to be leaders. They'd rather be the follower. Just tell me what to do and I'll do it. Okay, so these are some different roles and the formal names of group roles you might play. Okay, so have an idea what each one of these are. Okay. And then the last one I want to cover is box 11.6. What are some core competencies for communication skills of educators? The reason why I want to cover this is I know this is specific to communication of educators, but I would take this and say core competencies for communication skills. This is in general. Okay, I'm going to generalize it because as nurses, we need to be able to communicate effectively both in writing and orally and via email. Right? We're going to be communicating with lots of different people on medical teams. Social workers, doctors, PT, OT. We need to know how to communicate effectively. We need to know how to seek out input from people. We need to be advocates. Right? We need to be leaders. We need to be able to lead groups when talking about different issues. Okay, and so on. And our attitudes. We have to be able to listen to others with an unbiased manner, respect other people's points of views. So this isn't just with health education. It is in this chapter, but this is in general some core competencies that we all want to have. Okay. So that's group or community group education. Does anybody have any questions about that? And then we jump right into community assessment. Okay, we've talked about family assessment, we've talked about environmental assessment, we've talked about spiritual assessment, and now we're going to talk about community assessment and evaluation. Okay, so here, our client is the whole community. In previous chapters, we've talked about community as an individual. We've talked about community as a family. We've talked about community as maybe an aggregate of the population, say the elderly or the mental health afflicted. Well, now our client for this chapter is the whole community. So how do we do a community assessment? And again, if you go through your outline, which is your PowerPoint, we're going to start addressing these objectives. Okay. Okay, so think ADPI. What is the first part of ADPI? Assessment. So here we're doing a community assessment. Okay, what is community? You can read through the few definitions it gives. Okay, here's box 12.2 is types of communities. Okay, but here's what I want to cover. What are the concepts of community? How do we look at a community? We look at a community in 3 ways: place, people, and function. Okay, so table 12.1, we need to know. That's how we look at communities. What is the place? What is the community? Where is it located? How big is it? Do they have highways, railroads, sidewalks? What's the place? Where's the physical part of the community look like? Physical environment. And over here is where we might get our data sources. Okay? Because remember, we're doing an assessment. Think of yourself as you were just hired to be the community nurse of this new community that's in the neighboring state. Okay, you're going to go move to the state. You don't know anything about it, but you are hired to be the community nurse. And the one thing they're asking is your first job is to do a community assessment. What do you want to find? What should you find out? What do you want to find out? How are you going to educate yourself on how are you going to do an assessment? Well, first you're going to find out about the place. Or you're going to find out about all these three things, not in any particular order. Where might you find information? So you can look over here. Well, maybe the Chamber of Commerce, maybe the library, maybe the local newspaper. Okay. And then you want to find out about the population, the people in the community. Okay. Demographics. Do they have groups? Do they have book clubs? Do they have Bible studies? Do they have churches, businesses? And where might you find that information? Here's some suggestions. Okay, Tourist Bureau, Chamber of Commerce. Remember, you're new to this community, you know nothing about it. You've got to go start finding this information. And then what's the function of the community? What kind of community is it? Is it a college? Is it an educational community? Is it a college town? Is it a agricultural community? Is it a industrial community? Is it a transportation hub? Okay. And here's where you might get that information. But what I primarily want you to know is what the three dimensions are. How do we look at a community? People, place, and function. Okay. The other thing we need to know is what are some common community systems that we can find in every community? So I call them characteristics. Okay. All these 9, and there's probably 100 more system categories that are made up, that make up communities. They've listed 9 here. So every community is made up of all these 9. Some may be at the forefront than others, depending on what the community needs are. Okay. Some communities, let's say Washington, if you live in Washington, D.C., politics and government may be a very profound category that has a priority level. Maybe rural communities, not so much. Safety and transportation, it's going to look different in every community. Education look different in every community. But if you're asked a question to say, what are some common categories found within every community? And these are the 9. These are the 9 we start with. Okay, so the communities you live in right now, the community I live in right now, has all of these. Some more prevalent than others, but this is our basic list of categories found. Okay. So remember we talked about community-oriented practice and community-based practice. Remember, community-based, you're based in the community. You're taking care of the ill already. We're talking about community-oriented here in this chapter. And what does community-oriented practice mean? Okay, where we're trying to orient ourselves to the community. So we're trying to look at how can we do health promotion? Okay, how can we do disease prevention? Right, so just like the concept of community health has 3 common characteristics. Okay, we look at the stature, the structure, and the process. And each dimension reflects a different aspect of the community. Right? So the status, what's the status of my community? Think about yourself in your own community. Okay? We evaluate it in biological terms, emotional terms, and social terms. So for example, if you're looking at the biological status of the community, maybe you're looking at morbidity and mortality. It's higher, morbidity and mortality is higher in some communities than others. If you're in a community that has lots of violence, lots of gangs, you're going to have a higher morbidity and mortality rate, no question. Okay, so what's the status of your community? Is it a safe community? Is it not a safe community? And then what's the structure? Structure refers to resources, services and resources your community offers. So what's the structure? Do you have a lot of resources for your population, or do you have very limited resources? That makes a big difference, right? And then the process. How does your community function? Okay. The view of the community health as a process of effective community functioning or problem solving is well established. Meaning, does the community function competently? Are there partnerships? Are there groups that are working towards making the community better? Okay, are there groups trying to identify problems in the community and coming together and working towards common goals? Is it a very competent community, or is it a very incompetent community? Meaning, are people pulling together for the betterment of the community, or are they not? And then again, box 12.2 gives you a summary of status, structure, and process. Okay. That's a summary, what we just talked about, and where to get your sources. Okay. And then we want to know about community partnerships. What's the difference between, why are partnerships important? There's a lot of partnerships in communities that are going on that some we know about, some we don't. And so we need to know the difference between an active partnership and a passive partnership. So let's start with an active partnership. Let's say there's a business within the community that is providing after-school lunches for schools. They're actively participating in making it better daily. Okay, it's direct help, active participation. Where passive participation, more of your focus groups and working teams to maybe building a new park, building a new rec center, working behind the scenes on projects to better the community. Does that make sense? It's happening, but it's kind of behind the scenes. We're active, and one is not better than the other. I'm just trying to outline the differences. You guys understand that? Yes? No? Okay, so during our assessment, right, this will help us to better understand whatever population we're looking at. If it's an individual, if it's a family, if it's a group, right? Our community assessment helps to identify strengths, weaknesses, resources available to help. Okay. And just like ADPI, our community assessment phases involve logical, systematic approach to the initial phase of the nursing process, right? Assessment is part of the initial phase of the nursing process. Okay. Helps to identify common community needs, clarify problems, strengthen resources. All right. And assessing the community requires 3 steps here. Okay, gathering relevant, existing and generating existing data and generating missing data. Okay, so that's going to be the difference, and we'll go through this in a minute. That's the difference between data gathering and data generation. That's the first step. Developing a database. Then how do we interpret all that information to be able to identify what the community needs are? Okay, so I want to go through just a couple of differences on data collection. We need to understand the difference between data gathering and data generation. Okay, if we're gathering data, the data already exists. Okay, it's readily available data. Okay, it's usually talking about demographics. What are the age of the residents, gender distribution, socioeconomic characteristics, racial distributions? Okay, this information already exists, and previous in the chapter, we talked about where to find that information for our already existing data. Where data generation is a whole different way of gathering data. Okay, this information does not exist. So you're going to have to be out there interacting with people in the community. Okay, if we're looking, the Census Bureau isn't going to have information on what are the values and sentiments of your residents. What are the goals and perceived needs? What are the norms in the community? What are the influence structures? Those are things you're going to have to gather. Make sense? So there's a difference between data gathering and data generation. Okay. And then how do we collect the data? Well, we might be doing interviews, observations, windshield surveys, secondary analysis, or surveys. What's a windshield survey? Let's look at
Surveying within, surveying
ahead.
with, or surveying via car, walking around the boundaries of your town or your municipality.
And what things can you ascertain in a windshield survey? You could be riding, but you could be riding in your car, you could be riding on a bus, you could be riding whatever. It's going around observing. What kinds of things can we ascertain from a windshield survey? It's right here in table 12.3.
You can see the homeless population, the video from our other teacher. The video she put out where she videoed where they put up signs to stop panhandling.
Okay. Okay. So those are the kinds of things that you can observe. We can also observe all these other things. What are the boundaries of your community? What does housing look like? Does it have a lot of open space? Where do people congregate? What's transportation look like? Are there trains? Are there buses? What kind of stores are there? Are there strip malls? Are there big malls? Are there little corner stores? Are people out walking their dogs? Are people out congregating together? Is it clean? Not clean? A lot of trash around or not? We can observe race and ethnicity. Okay. Are there hospitals? What kind of businesses are there? Okay. So those are windshield surveys. Okay, and then the other thing we need to remember is, you're new to this community, you don't know anybody. There's another way to gather information, and that's talking to key informants. I call them stakeholders. Who are your key stakeholders in your community you might want to talk to? What if you're in a community that has a high crime rate? Might you want to talk to law enforcement? Talk to social services? Might you want to talk to whoever your stakeholders are? Maybe the pastor of the local church, maybe the head of the PTA, learn about education in the community. Maybe you want to talk to the mayor, local politicians, find out what their concerns are. Okay. So it's up to you to reach out to who you feel the key stakeholders are. Okay. And then another thing to be careful for is when you're using websites or you're giving people resources to get on websites. What do you need to be mindful of? How current is the information? When was it last updated? Is it biased? Right? Is it concerning at all to you? Is it easy to navigate? And that's both for you and people you might be giving resources to that ask about demographics of, so this would be part of what you're doing with your vulnerable populations assignment. You are using websites to gather information. So think about these things when you're using the websites. Do you have current data? Is it reliable? Okay. And then let's talk about this. One of the biggest challenges we have as a brand new community nurse, walk into a community, nobody knows you, is we will have issues with being accepted. How do we gain acceptance into communities? Okay, how do we generate trust? Because a community doesn't want anybody, they don't really want anybody coming in and poking around and asking questions about what's going good, what's not going good. Okay, so you have to gain your acceptance in the community. So the nurse is usually an outsider. She may represent an established healthcare system, either known or not trusted by the community, right? The community may react with indifference, hostility, right? Is a nurse feel secure? If this is her first job as a community health nurse, she may feel insecure or not comfortable in her role. Okay. So the nurse's success depends largely on the way he or she is viewed by the community as she enters into the community to do her assessment. Okay. And so here's some examples of primary or kind of interventions that people have tried and been successful with. Taking part in community events. This is how to get you engaged in the community. Looking and listening with interest, visiting people in leadership positions, using peer groups for support, keeping appointments, clarifying community members' perceptions, respecting individuals' right to choose whether they want to work with the nurse or not. Okay? Really important to gain acceptance. Okay? Questions about community assessment. Do you have a better understanding of how to do a community assessment? Lots of factors. Lots of factors to think about. Okay? Any questions so far? Let's shift gears and talk about economic influences in healthcare. Okay, so this is a general topic. What are the economic influences that are part of our healthcare system, current healthcare system? Okay, in your outline, what are some factors affecting resource allocation? Remember, we're talking about healthcare economics, economic influences, the uninsured, the poor, the access to health services, rationing. We'll talk about all of those. So again, have a look at your objectives. Make sure you can answer those objectives. Okay. What we do know is that poverty is directly related to poor health outcomes. We've talked about that for the last 7 weeks. Okay. Poor health outcomes lead to a lot of issues. Okay. They lead to poor educational outcomes for kids, poor nutrition, maybe lower productivity in the workforce, right? And we're experiencing this all over the country now, the unstable economic issues going on, gas prices, food prices. Okay. And obviously our goal is to try and improve the standard of living for everybody in your community, and especially including the poor. Okay. Couple of statistics that are quite shocking. 97% of healthcare dollars in this country are spent on individual care. So when you go to the ER, you go to urgent care, or you have surgery. Okay, where only 3% are spent on population level healthcare, which is kind of sad because population level healthcare is kind of your prevention, your primary prevention strategies, preventing obesity, preventing diabetes, preventing drug use. Okay. So being proactive, 3% is spent on that kind of activity. 97% of our healthcare dollars are on individual care. United States spends more than any other country in the world on healthcare. Okay. And we know that our healthcare system is at a point that it's just not affordable anymore, which hence is why we have so many uninsured. The ACA Act helped with that tremendously, but we still have millions and millions of people uninsured. Okay. We as community nurses need to know about health economics. Okay. Because oftentimes when annual budgets come out and the states are allocating their funds to local public health departments, often it's the public health nurses that are the ones that are allocating resources. Is this a community that needs more immunization clinics? Is this a community that needs more free pediatric visits? Because there's not enough, if it's a rural community, there's not enough specialists, right? Pediatric specialists. What are the needs of the community? Okay. So often the public health nurses, community nurses are in a position to allocate those resources based on what the needs of the community are. Okay. Okay, what are some factors that affect resource allocation? Okay, number one, we have the uninsured. Okay, that's one factor. The other factor we have is the poor. Right? We know that socioeconomic status is inversely related to mortality and morbidity with almost every single disease. Poor Americans with an income below the poverty level have a mortality rate of almost 3 times of middle income Americans. And that's even after accounting for all the risk factors: age, sex, race, education level, risky behaviors. Okay. The other factor is, another factor is accessing healthcare services. Right? Access is a public health issue. Okay. You may or may not qualify for Medicaid. Okay. What if you don't qualify for Medicare or Medicaid? Then what? You're uninsured. What if you lose your job and you lose insurance? Your access becomes more and more limited. So access is a factor that affects the economics of healthcare, because where do the uninsured get their care?
In the emergency room.
And is that more expensive?
Yes.
Okay. And then another factor is rationing. Rationing sounds like a really bad word, but in this chapter, it's used it implies reduced access to care and potential decreases in quality of care, especially the uninsured. Okay. The Healthy People 2020 goals for this chapter are pretty darn simple. Okay. They have to do with access. Okay, so we need to know these. We want to increase the proportion of people with health insurance. And we want to reduce the proportion of people who experience difficulties accessing medical care, dental care, prescription medications. Okay. And then you have your levels of prevention. Okay, these are economic prevention strategies. So please have a look at these. You know, in reviewing exams with students, there's still some confusion out there of what primary, secondary, and tertiary are. I really encourage you to, with each of these chapters we're covering, please go back and look, okay, at what each box in these chapters we're covering are, okay? We don't need to worry about the phases, okay? I highlighted your QSIN box, our competency that they're addressing in this chapter is teamwork and collaboration. Excellent. It's an excellent read. Okay. Okay, so demographics affecting healthcare. The biggest demographic affecting healthcare is the aging population. We know this, right? Why is that? What is it with the aging population that makes them a major demographic challenge?
Living longer.
Yep. And so what do we, when they're living longer, what issues do we have? Chronic diseases, right? That's where most of our healthcare is going. Chronic diseases. Okay, so the aging population is expected to affect health services more than any other demographic factor. All right, although many older adults are independent and active, they're likely to experience multiple chronic conditions. Okay, that's where our healthcare dollars are going. Okay. Okay, and then the last part of this chapter I want to cover of the 4 ways that healthcare is financed. Okay, the first is public support. Okay, those are your Medicare, your federal programs, state programs, Medicare, Medicaid. Okay, and here's your synopsis of Medicaid and Medicare. We've gone through in other chapters, but here's a good summary. Okay, I highlighted the recipients, who's eligible, what is there, how is it administered, is it federal or state, and then what types of coverage. All right, remember we talked about the differences. I think we talked with regards to in our home health chapter, right? You have to be homebound to apply for Medicare, or not so much for Medicaid. Okay, so have a look at that. So that's our first public payment system. Okay, and all this information is part of that public payment system. And then public health. We talked about that briefly, where the government has an annual budget. They plan for costs of state, right? And then states plan for costs of local health departments, right? So we're talking public health agencies here. And what programs do they administer? Maybe the WIC program, maybe an immunization program. Right, so selected public health programs seek out reimbursement from the state. Okay, so we have public health responsible for paying as well. Other public support is the third area. This is the TRICARE. For those of you that don't know what TRICARE are, it's for military families and their dependents. Okay, and this also includes the VA. Right, so other public support, TRICARE, VA provide needed healthcare services to these very important populations. Okay. And then the last one is private. Then the rest of this chapter goes through all the kinds of private support. We don't need to go through that. I just want you to know that there are 4 types of ways that healthcare is financed. Okay. Public health, other public support, and private. Okay, and this is your insurance companies, your employers, your managed care, when you have insurance through your employers, right? Or you go and find insurance out in the open market. Okay, lots of different kinds of private ways to get insurance. Okay. employers, individuals going looking for insurance, managed care arrangements, okay, HMOs, PPOs, okay? So we don't need to get into all that. I just want you to know the system. So that's that's how our economic influences are, or that's some of the important concepts to know about what are the economic influences on our healthcare system. There's a lot. Okay. Okay, we're going to jump into, this is kind of a hard chapter, violence and human abuse. Okay. We as nurses are going to be taking care of clients that are either victims of abuse, perpetrators of abuse, victims of child abuse, perpetrators of child abuse, sexual abuse. Doesn't matter where we work. Okay, we will be subjected to taking care of different people that have been involved in different kinds of violence. Okay, and human abuse. Okay, so a couple things. Okay, healthy people's goals are come up right away, page 434. Okay, all their objectives are aimed at reducing violence. So I'd like for you to know that this Healthy People 2020 box on page 434. Okay. What are some factors that influence violence? Okay, social and community factors. Okay, first and foremost, this is in your PowerPoint as well. Work. When we think of work, we think of workplace violence. Workplace violence, how does that happen? People unhappy with work. Maybe they didn't get a raise, they didn't get a promotion, they're fighting with other employees. We see this pretty frequently, right? Workplace violence, right? Education. In schools, we see school violence, school shootings, bullying, harassing. Okay, so violence stems from the schools as well. Media, what part does the media play? You know, what are the video games our kids are doing? What are the TV shows they're watching? What do they watch on YouTube? What are they watching on TikTok? What are they watching? You know, media plays a role. Okay, religion. Churches are shot up, mosques are shot up, wherever you gather to worship, religion becomes an issue and can incite violence. And same with your population, your community. Okay, if you live in a community that's full of gangs and full of crime, violence is going to be something you can't avoid. Okay, if you live in a community that doesn't have a high crime rate, doesn't have gangs, it's going to be a better place to live, right? When people are poor and live in crowded conditions, tension, violence, anger. Okay, when you live in a community that doesn't have many resources for kids or people, no parks, no recreation, no basketball courts, nothing for people to do. What do? They don't have anything to do. Whereas if you live in a community that has, whether it be movie theaters or parks or organized sports, whatever, that might be a better community to reduce the risk of violence. Okay? And this goes into talking about youth gangs and how youths may feel powerlessness and join gangs. And then community facilities, you know, we just talked about it. What kind of community facilities does your community have? Do they have boys club, girls club, after school activities for kids? Okay. So lots of things play into this. And then the next section is violence against others or yourself. Okay, they talk about homicide. We know what homicide is. Assault, sexual violence and rape. And then suicide against yourself. Okay, so those are the different types of violence that are addressed in this chapter. Okay, how do we identify family violence and abuse? As nurses, we need to have those assessment skills, right? Family violence can be sexual, emotional, physical, and may cause significant injury or death. Okay. Family violence in general is about control. Most powerful versus least powerful. Right? Do you know how to recognize a battered spouse, battered woman, battered man, battered child? Sometimes we don't get to do that until they show up in the emergency room. You know, as a school nurse, I had really firsthand experience with trying to identify these abusive patterns in the school setting with these kids before they ended up in the emergency room. It's really hard, but you have to be able to recognize the symptoms, signs and symptoms of violence and abuse. Okay. And there's some really good how-to boxes in this chapter. What are some types of family violence? Well, we just kind of went through it. Physical abuse, sexual abuse, child abuse, neglect. Okay, and here's a couple of some information I want you to be aware of. Box 25.1 talks about abuse is about power and control. And I don't need you to know everything in this box, but I'd like for you to know the specific headers. That abuse is about isolation, is about threats, could be about intimidation, using the kids, being cruel, withholding support. Could be one or many of these. Okay, sexual abuse. Okay, and child abuse, right? Many kids are exposed to violence, not only as victims, but also as witnesses. Okay, got lots of kids who are witnessing domestic violence in the home. Okay, how do I ask this? We are all mandated reporters. What does that mean?
It's our duty to report any suspected abuse or neglect
At work?
at work, in the community.
What about at the grocery store? Do you guys have to report concerns that you might observe in the grocery store or Walmart or Target or? This is an important question. I need you guys to answer. Do you understand the responsibility of mandatory reporting? Doesn't just have to be child abuse. It could be elder abuse. It could be any kind of abuse. You guys, us as mandatory reporters, have to report anything. Okay. Okay, box 25.2, excellent box, determining risk factors for child abuse. Okay, this was something that I went through in the schools all the time. There's 11 here, but there were many more on our paperwork at the schools. How do we determine risk factors? Okay, these were the questions that we had to ask ourselves. Social worker was involved. School psych was involved. But we have to be able to understand risk factors for child abuse, especially if you're working with kids. Okay. And then same, how do you identify potentially abusive parents? Have to be aware of that as well. So have a look at that box. You know, if you're working in the hospitals or you're doing assessments in the ER or in the hospital and you suspect any kind of abuse is going on, how do you identify potentially abusive spouses or partners. Okay, and then here on page 445, signs of abuse. There's examples of physical abuse, emotional abuse, financial abuse. And then older adults. Okay, how do you have to be able to recognize signs of elder abuse. Okay, as with child abuse or domestic abuse, a lot of it goes unreported. Elderly people are afraid to tell anybody. They're afraid their care is going to get cut off. Their finances are going to get cut off. They're going to be too much of a burden. And so I want you to review this box. How to on page 447. How do you potentially recognize elder abuse, potential or actual elder abuse? Okay, be alert to the following things. This has to be in your toolbox. Recognizing signs and symptoms of abuse, abusive patterns, abusive people, whether they're kids who have been abused, adults who have been abused, partners who have been abused, elderly who have been abused. You have to have that in your toolbox, because you're going to be working and assessing and caring for clients in these situations. Okay. And then this is, I'd like for you to know this. So primary prevention, what can we do? Primary prevention begins in the community. Okay. And our approach in the community tries to pull together whoever needs to be on the team to try and reduce violence, whether it's criminal justice, education, schools, social services, advocacy groups, okay, public health, all in an attempt to try and prevent violence. Okay, so here's an example of what some communities have used. Okay, excellent strategies. Teach children how to cope with anger and stress and frustration. Maybe do family programs to teach parents how to deal with their children more effectively. Preschool programs that develop intellectual and social skills. Excellent. Right? Do public education programs to educate communities about different forms of violence and how to get help, how to intervene. Some kind of a nursing home visitation program with families at risk, with the goal of the aim of preventing abuse and neglect. Okay. And lastly, lobbying for a passage of legislation to outlaw physical punishment in schools and marital rape. So here's a great list of pulling together the community as a team to reduce violence and some strategies that some communities have implemented. Okay. Okay, that's it for violence and human abuse. Let's talk about infectious disease prevention and control. We're in chapter 27 right now. There's a few things we need to know about in this chapter. Okay. Healthy People 2020. Okay. Their objectives are related to immunizations and infectious diseases. And that's what this chapter is about, infectious diseases. So please know these, page 457. We've already went through this in previous chapters. What is the transmission? How are communicable diseases transmitted? Remember the epidemiological triangle? We need the agent, we need the host, and we need the environment. Right? Transmission of communicable diseases depends on the successful interaction of whatever the infectious agent, the host, and the environment are, right? Changes in any characteristics in any of these three factors may result in disease transmission. Okay, And then it goes through, the first part of this chapter goes through the agent, host, and environment, which we're not going to go through. We've already been through it. If you would like to read about it, that's fine. You do need to understand certain modes of transmission, and there are 4 of them. Page 459. You need to understand the definition of what a vertical transmission, a horizontal, a common, and a vector. Okay. And we need to understand the difference between what is a pandemic, what is an epidemic, and what does endemic mean. Okay. What would be an example of an endemic disease? Endemic means that there's always going to be a presence. You can't never get rid of it. What's an example of that? How about the flu? How about pertussis? Okay. What about epidemic? Okay, epidemic refers to the occurrence of a disease in a community or a region that's in excess of normal expectancy. So epidemic. Okay, and then pandemic refers to an epidemic that occurs worldwide. That would be COVID. Have you guys all heard about in the last week or so about the new monkeypox? You guys heard about that? Monkeypox is a new virus that's starting to spread. Okay, how do we surveil communicable diseases, right? So when we conduct surveillance, we're first trying to figure out the who, when, where, and what. Okay, who's getting it? When are they getting it? So let's take this new monkeypox, for example. Who's getting it? When are they getting it? Where are they getting it? What countries are it in? And what is it? Right? And then when we have gathered all the information, then we have to understand why. Okay, so a good surveillance system systemically collects, organizes, and analyzes current, accurate, and complete data. Okay, then when we have all that data, we need to promptly release that data to those who are going to be planning, effective planning for transmission, decrease transmission, eliminate transmission, right? So we need to get that data to people who will be planning, implementing and evaluating how this is spreading, why it's spreading, and putting in control systems. Okay. That's exactly what's happening right now with this monkeypox. We're trying to gather as much information as possible. Okay, and once all this information is gathered, which a lot of it has been, now it's now in the hands of people who are planning for travel restrictions, planning whatever's going to happen, have to be put in place. Okay. Your second question on your attestation today is, what are the, and this is in your one of your PowerPoint slides, what are some emerging infectious diseases that we're worried about? Okay, and emerging, when we say emerging, we mean over the last 10 years. There's 4 of them. Okay, Ebola, West Nile, the flu. We go through them right here in box 26.2. I've highlighted them. And HIV. Okay, so the 4 are highlighted in yellow. Ebola, HIV, influenza, and West Nile. Those are considered the 4 emerging infectious diseases over the last 10 years. And just know what each one of those are.
Professor, will COVID be added to that list?
I don't know. I don't know. Probably. Yeah. Yeah. Good question. Okay. Okay, and so page 463, I know I've highlighted this whole section. This is an excellent, I want you to read right down through levels of prevention. This is an excellent summary of primary, secondary, and tertiary. Okay, I know we have primary and secondary and tertiary in every chapter, and they're usually simply in boxes. This chapter takes the time to explain, once again, differences, primary, secondary, and tertiary. So it's page 463. I would highly encourage you to read this section all the way through the box. Okay. So let's just review the box. These are related to infectious disease intervention. So primary, educate about safe food handling practices in the home. Well, that's primary because we're trying to prevent any food diseases, infectious diseases in the home. Prevention, right? And it says right here, the goal. Here's the goal: to prevent the occurrence of a disease, primary, secondary, to prevent the spread of the disease, tertiary, to reduce complications and disabilities. So this is an excellent, excellent summary. Okay, so secondary, immediately evaluate the possibility of any kind of food-borne outbreak, right? Screening those at risk. Then tertiary, immediately treat any foodborne infection. So you have to assume that people have been infected, maybe with E. coli or salmonella, whatever. And then you work on treating them. Okay. So then the last section I want to go through here is vaccines. Okay, we know that vaccines are this is fact. Vaccines are one of the most effective methods of preventing and controlling communicable diseases, right? A lot of things have been eradicated because of vaccines. Polio, diphtheria, pertussis, measles, right? Previously occurred in epidemic proportions are now controlled by immunizations, right? In this country, we have a federal legislation that's called No Shot, No School, which means kids aren't supposed to be in school if they're not updated with immunizations. However, there are many kids that aren't immunized, okay, for whatever reasons. We have personal exemptions in which parents fill out paperwork that says, I don't want to vaccinate my kids. We have religious exemptions due to religious beliefs, not vaccinating the kids. And then we have medical that physicians fill out. Okay, so we have to be mindful of those. We are going to have, it usually runs, at least for me in school nursing, it usually runs between 6 and 8%. For me, it did in my school, 6 to 8% of kids aren't immunized for whatever reason. Okay, and so what we can do is try and educate parents. Okay, if they don't want to vaccinate, that's their choice. But we can just keep trying to educate them that vaccines are the most effective method. So we have to have a plan. We had to have a plan in place for the schools if we had an outbreak of pertussis or an outbreak of varicella, chickenpox. Those are the families we'd contact first. Tell them to keep their kids home until this passed. Because without an immunization, if the kids got sick, they'd probably get a lot sicker. Okay, and then down here, it gives some groups of children that are higher risk for not being vaccinated. Okay, we need to know those groups. Okay, despite the availability of free vaccines. Okay, inner city kids from minority and ethnic groups are particularly at risk for incomplete immunization. We talked about this, kids from religious communities whose beliefs prohibit them from getting that vaccines, and then parents who have philosophical objections. Okay, so a lot of work to be done there, but all I could do with my families who chose to do exemptions was just educate them on what would the plan be if we had a particular outbreak. That's all you can do. Okay. And then it goes through all the childhood diseases. Okay. So that's it for infectious diseases. Any questions on that? Okay, then the last chapter to cover is infectious diseases, so very specific ones. HIV covers 4. HIV, hepatitis, tuberculosis, and STDs. Okay? I'm going to let you guys cover this chapter on your own because the objectives are very specific. I need you to go back and get this information on each of these 4 from the chapter. You don't need to read the chapter from start to finish, right? But one of the things we need to know is what's the history of HIV? That's the first topic in the book, in this chapter. What is the history of it? Okay, and what is the plan for client education with HIV? Okay, so that's your first objective. And then I need you to review each of these 4 infectious diseases for what are the clinical signs of each of them? What are the clinical signs of HIV, hepatitis, STDs? And then number 3 is identifying the groups at greatest risk for each of these. And then as nurses, how do we prevent these diseases and care for people who are experiencing them? So I'm going to let you do that legwork on your own, okay? And you can go right here into the chapter outline and just click on where to find this information. Okay, this is also excellent, the nurse's role in primary, secondary, and tertiary. Once again, it goes through very specifically what is primary, secondary, and tertiary. Okay, so that's on page 490. Okay, please have a look at that. Here's a nice primary levels of prevention box related to nursing interventions. Primary, provide community education about prevention, vaccinations, community outreach. Okay, excellent section. Okay. Here's all things that would be in primary. Okay. You have your teaching about safe sex, teaching about drug use, teaching community outreach, education, and evaluation. Then you go into secondary. How do we do our screenings? Right? How do we do our partner notification and contact tracing? Okay, and then tertiary, something's going on. They have a TB or an STD. How do we treat them? Okay. Therapy, standard precautions. Okay, so this is an excellent, excellent section on primary, secondary, and tertiary. Okay. So I know we covered a lot, but I'm really trying to hone in on what we need to pull out of each chapter. Is that helpful? I don't need everybody going back and reading every chapter from start to finish. And if you're following along with me, you can highlight what I've highlighted. Okay. Let's pull up our attestation, week 7 attestation, please. And I can tell you the first question is, what are signs of abuse? And we can all start throwing things out. I'll start. Bruising. What else?
Behavioral changes.
Yep. Great. Keep going. Maybe if everybody could throw one sign out so that I can hear everybody's voice, that'd be great. What are some signs of abuse? Physical, sexual, emotional, financial. Unexplained injuries.
Constant STD testing.
or constant STDs, recurrence. Yep, yep. What else? Come on, guys, you're mandatory reporters. What are you going to be reporting on?
Name calling bee.
Absolutely.
Malnutrition and dehydration.
Absolutely. Excellent. Excellent. Anybody else? Okay. Okay, our second question is, what are the 4 emerging infectious diseases? What are they? They were in chat. Go ahead. Ebola? Yeah. What else?
West Nile, HIV,
West
and
Nile.
influenza.
Yes. Okay, who's that? Monica?
Yes.
Excellent. Everybody hear what Monica said? Say it again for everybody.
Ebola, West Nile, HIV, and influenza.
Okay, and that's also in your PowerPoint. There's actually a nice slide in that chapter PowerPoint about the 4 of them as well. So, and again, I'm not pulling out the PowerPoints because my expectation is that you have just a brief look at them each week to know what we're going to be covering. So I would prefer to take the PowerPoint, take the important points out of the PowerPoint and go cover those in the chapters. Okay. Does anybody have any questions? No questions. Okay, we covered a lot. You should be getting your, like I said, your exam 3 study guide here soon this week. When you get it, just take that study guide and start plowing through all the information, all your notes from lectures. Okay, and once again, the information on the study guide should be covered in lecture. Okay, so you got 2 weeks to work with, weeks 6 and 7, and then next week we'll cover the last part of the study guide, which is all the other 8 chapters. Okay. Okay. Let's see, what time is it? I'm going to stop recording.